Hi, welcome. See, we have you in for a cranial nerve exam today. Great. Why don't you have a seat? I'm just going to get gloved up. In the meantime, we'll go over the exam and we'll get started, alright? Wonderful. So, have you had a cranial nerve exam in the past? A few? So you know that this exam is about testing your sight, your sense of taste, sense of smell, your hearing, and your sense of touch. So we'll go through all of those today with you and do a few other checks on you just to make sure everything's okay. Most of our patients find this to be an extremely relaxing experience. So if you do find yourself drifting off at any time, don't worry about it. I'll just gently wake you and we'll continue. So while I get my gloves on, can you tell me, have you experienced any issues with your vision lately, your hearing, a sense of smell difference, loss of taste? No? Good. And how's your jaw been lately? That's all connected up with all of those cranial nerves in your head. Any trouble chewing, swallowing, eating in general? No? Okay. That's good to hear. When was the last time you had a cranial nerve exam? About a year ago. Okay. Well, it's a pretty routine exam, and normally they can go pretty quick, but I have on your chart that you need one that's a little more thorough today, is that correct? Did you bump your head by any chance lately, or? No, it was just recommended you get a new one? That's fine. That's what we're here for. So, now that I have my gloves on, I'm going to scoot close to you, and we're going to go over that face of yours, make sure that there's no contusions, cuts, lumps, bumps, things like that. And I'm also going to check your scalp, okay? Alright, so let me just come up close here. Just going to be palpating, palpating, palpating. Your temples and your forehead, any pain there? Good, good, good. Don't want to have any pain. Just from a simple touch and a little bit of pressure. Alright, so if I run my fingers right here on your T-zone, any pain? No. Now if I apply a little pressure, sides of your nose, any pain? Good. Run my fingers right under your eyes, gently pressing on your sinuses. Just gonna run my fingers under your eyes, just gently applying slight pressure. Any pain? Good. Touch your cheeks. Just gonna press in gently. Press in gently. Any pain? Come down, down, down under your jaw. Just running my fingers along the back of your jawbone here. I'm just feeling for any irregularities. Down, down to your chin. Good. Good. I'm feeling your neck. Looking for any lumps. Just palpating, palpating, palpating along the trachea. Good. Good. Very good. Okay. Everything looks good there. Now I want you to just look at me. I apologize for that loud traffic outside. Alright, so just look straight at me. Give me a big old smile. Good. Big old frown. Good. Puff out your cheeks for me. Very good, very good. Now I'm going to place my hand right here on the side of your face, and I'm just going to try to push, and I want you to not let me, alright? So here we go. Push, 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 Very good. One more time. Push, push, push. Wonderful. Do the other side here, the other cheek. Ready? 1, 2, 3. Push, push, push. Good. One more time. Push, push, push. Very good. Now I'm going to place my hands on your shoulders. I'm going to try to push them down, and I want you to shrug them up. Don't let me push them down. Just going to reach here. 1, 2, 3. Push, push, push. Very good. Do it again. Shrug up. Don't let me push them down. Push, push, push. Very, very good. You're doing wonderful so far. Going to go back to your neck here. I'm going to place my hands right under your jaw. Just going to palpate your lymph nodes a little bit. Any pain, discomfort? Okay, good. And I'm going to hold on to your jaw right here and clench real hard for me. Clench, good. Place 2 fingers under your jaw on each side. Clench again. Good. Alright, and then back to right here. Just going to place 2 fingers on the sides of your trachea, and I want you to swallow for me. Let's go ahead. 1, 2, 3, swallow. You do it again. 1, 2, 3, swallow. Good. Well, everything seems to be intact physically so far. So now I'm going to do a little more of an in-depth scalp exam on you. Just examine your scalp, look at your hair follicles, make sure everything looks okay up there, alright? Alright, so just sit still, and I'm going to come up real close. We'll go over your scalp, and then we'll move on with the rest of the exam. Good. Okay, so we're going to start off with this scalp exam here. So all I'm going to be doing is just gently examining your scalp, looking for any signs of redness, any lumps, any contusions that should not be there, any bruising, or anything that could possibly be of any concern. I'm just going to use these to part the hair. Looking underneath. Let me know if at any point anything is uncomfortable, hurts. Okay. Just going to, if I gently touch right here, any pain? No, good. Good. Seems our therapy dog for the office woke up. Alright, he'll probably just go right back to sleep. He's just getting comfortable. And there he goes, lying back down. Oh, sorry, I messed up your hair a little bit. So just gonna continue to look. Just going to use my comb. Gently Making sure I don't feel any bumps or see any signs of extremely dry skin. Okay. That looks good. Just going to mark this. Take one more look over here. Just to make sure. Get over here. A little patch of dry skin here. Does that hurt when I touch it? No? Okay. But otherwise, everything is looking good up here. That's what I like to see. Alright then, so just once more over your scalp, palpating gently. Any pain, tension, discomfort. Good. Alright, then we can move on with the next portion of our exam. Well, your scalp looks super healthy. I didn't see any problems. So for the next part of the exam, we're going to be testing your sense of smell. Alright? So I have 3 scents over here. And what I'm going to ask you to do is just close your eyes for me. Close them, close them. I'm going to open this up and bring it right under your nose. Take a big sniff and tell me what you smell. Citrus, very good. Alright, to the next one. Keep those eyes closed for me. And bring it under your nose. What do you smell? Cinnamon, very good. Okay. And one more. And this one should be very easy, but go ahead and take a smell. Lavender, very good. Most people get that one. Alright, now for the taste test. Okay, now in this bottle, and 2 others like it, I have a clear, colorless liquid. They all have different flavors. So what I want you to do is close your eyes for me. Close them, close them. And open your mouth, and I'm just going to spritz a little on your tongue, okay? Alright, close them, close them. And 1, 2, 3. What do you taste? Cinnamon, very good. Alright, here we go. Alright, keep those eyes closed. 1, 2, 3. What do you taste? Lemon, very good. Okay, and last one here. This one might be a little more difficult. So, keep those eyes closed. Keep that mouth open. 1, 2, 3. What do you taste? Cherry, very good. Most people do miss that one. Alright, you can open your eyes now. Would you like some water? Rinse the flavors out, or are you okay? Alright, good. For the next portion of the exam, we are going to be looking at those eyes of yours. So, this is going to be a little more in depth and take a little bit of time, but don't worry about that. We're going to make sure everything is working perfectly. So for the first part, very simple. I want you to sit straight, look right at my nose, and I want you to just follow the light with your eyes. Don't move your head, just follow the light. side to side, side to side, side to side, and now up and down, and up and down, up and down, up and down. Keep following that light, keep following that light. Very good. Very good. Just keep following my light. Keep following my light. Keep following my light. You're doing wonderful. Very, very good. Alright. Now we're going to do the same thing. Look straight at me. Except I'm going to have my finger up here. And I'm going to try to distract you with it. Do not get distracted and keep following the light, okay? Don't get distracted. Don't get distracted. Don't get distracted. Good. Good. Don't get distracted. Good. I'm going to do the same thing over here. Alright, here we go. Don't get distracted. Don't get distracted. Don't get distracted. Don't get distracted. Very, very good. Now, we're going to do another follow the light, except this time I'm going to occlude one of your eyes. So just follow that light. Don't move your head. Just follow. Good. Do the same thing over here. Good. 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 Very good. Now I'm going to test your pupil response. So I'm going to do the same thing, occlude one eye, and I'm just going to swing the light in and out like that to test your pupil response. So we're going to hold that up just like that. And we're going to swing in and out, in and out, in, out, in, and out. Good. Going to cover this one, do the same thing. In, out, in, out, in, out, in, out. Wonderful. Pupils are acting perfectly. Now for this next portion, I have to get a little close with you. I'm going to be looking back into your eye. My magnifier here. So I'm just going to get real close. I'm going to hold your eye up. And I'm going to look inside, okay? Just stay still. I know this can be a little uncomfy, but it won't take too long. Okay, go ahead and look up for me. Good. Down. Good. To the left. Good. And to the right. Good. Alright, we're going to do the other eye now. Same thing. Just going to hold it open. Okay, very good. Look up. Good. Look down. Good. To the left. And to the right. Very good. Everything looks good back there. Not seeing any damage. Corneas look good. Retinas look good. And that ocular nerve looks perfect and intact. Alright? So, for the next portion, we're going to do a little bit of a vision test. Well, a full vision test. So to start that, start with our basic eye chart here. We'll move on to the larger one on the wall, and then we're going to get into a color blindness test. So, starting with the top here. Just repeat after me, both eyes. Good. 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 Mm-hmm. Very good. Good. How about down here? Good. Mm-hmm. Very good. Yes. Good. All the way at the bottom here. Mm-hmm. Good. Very good. Good. Okay. So basic eyesight is good. Now what I would like you to do is stand up and go stand right over there. And we're going to do the larger eye chart on the wall, alright? Fantastic. Let's get started. Okay, so now we're going to go through the classic eye chart. I want you to just read each letter as I point to it. We're going to go through a few lines in a row, and then I'm going to be pointing sporadically, and you just repeat what you see. Alright, start at the top. Good. 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 And here. Very good. How about this line right down here? Good. Now I'm going to point to a letter sporadically, and I would like you to just repeat which one I point to. Ready? Good. 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 Yes. Yes. Good. Now we're going to go a little faster. Good. Good. Very good. Good. All right. One more time. Good. Yes. Very good. Good. And read this line backwards for me. Good. Identify this color. Identify this color. Good. Well, everything looks good here. Let's continue on with our exam. Okay, my friend. Well, you aced that eye chart. You can say that your acuity is perfect. We're going to move on to the color blindness portion of the exam and color recognition. So what I have here are a bunch of different colored gels. I'm going to be holding them up and then asking you if you can see a light through them. These are very delicate. So, this first one, what color do you see? Red, very good. Now, can you see the light through the gel? Okay. Good. See, very easy. Let's get out this next one. And what color is this? Blue. Very good. Going to hold that up. Now, can you see the light through the gel? Very good. Good. Get this next one out. And what color do you see? Yellow. Alright, so let's get that right up there. You should be able to see this relatively easily. Good. Good. And moving on. Now this one causes a little controversy with my patients. Some like to say it's red, but what do you see? I say it's orange. So we're gonna hold that up. Can you see the light? Can you see it? Good. Good. I think we only have a few more to get through. We don't need to do another blue. Let's not go over the medical equipment. What color do you see? Pink. Good. Now, some folks have a little trouble with this one, but can you see? Good. And I think we have one last one. What color do you see? Green. Good. And hold that up. Can you see the light? Very good. Wonderful. Well, safe to say, I think your sense of color is perfect. However, I do want to do a more traditional Ishihara color plate test with you, if you don't mind. I have my handy dandy color plates right here. This is a whole book of them. So what I want you to do is just tell me if you can read the number on the plate. So I'm going to start off right here. Very good. This one. Good. This one. Good. How about this one? And this one right here. Good. This one. This one. Good. This one. This one. Wonderful. This one. And this does throw some people. Very good. And that one. Great. That one. That one. Good. This one. Wonderful. Fantastic. Alright. So now instead of numbers, you're going to see some different squiggly lines. Can you see the squiggly lines on this one? Good. And how about over here? Wonderful. This one. Good. And this one. Good. Back to numbers. Good. Very good. This one right here. And this one right here. And squiggly lines again. Can you see this one? Good. How about that one? Good. Squiggly lines. How about this one? Good. This one. Very good. Squiggly line here. Squiggly line here. Good. Squiggly line here. Squiggly line here. Good. Last one. Squiggly line here. Squiggly line here. You did absolutely fantastic. You got everyone right. That will definitely be going in my notes. Okay, so to finish up this eye exam portion here, we're just going to do a little peripheral vision check. So what I'm going to do, hold up my fingers like this, and I'm going to move them out and then into your vision, and I want you to let me know when you cannot see them and when they come back in, okay? Alright, so here we go. Ready? Good. 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 Now we're going to go this way. Good. Good. Great. And good. Yes. Good. Very good. Well, my friend, I think your eyes are absolutely perfect. So the next portion of this exam, we're going to be focusing on your hearing. Alright? So first things first, I'm going to take a look inside those ears of yours, make sure that there's nothing wrong, no obstructions, no excessive wax buildup, and then we'll actually get into the hearing portion of it, okay? Alright, so 1 second. Just need to get my otoscope attachment. There we go. So, I'm going to just be shining this in your ears, looking for anything that shouldn't be there. So, hold still for me. And I'm going to get right here in your ear. Just going to be looking for anything wrong. Okay. Well, tympanic membrane's nice and pearly white, like what I see. No excessive wax, no redness, no bruising on the eardrum. Good. Alright, the other side here. Just gonna take a look, Okay. Good. Tympanic membrane, nice and pearly, like what I see. A little more wax on this side, but nothing excessive. If that does get out of hand though, please let us know. We can clean that up for you. Alright. Everything looks good inside. So now we're going to go through a litany of hearing tests with you. For the first one, it's very simple. I'm going to ask you to close your eyes for me. I'm just going to make a noise on either side of your head, and you're going to let me know if you can hear it or not, okay? Alright, so close them, close them. Here we go. Good. Good. Mm-hmm. Good. Fantastic. All right, keep those eyes closed, and now I'm going to whisper a word in each ear, and you repeat it back to me, okay? Okay. Coconut. Good. Vacation. Good. Relax. Good. Sleep. Good. Plucky pineapple. Very good. Jade rabbit. Wonderful. Okay. You can open your eyes for a minute. Okay. So for the next portion of this hearing test, I'm going to be using this tuning fork. I'm going to ring it, hold it up to your ear, and I want you to let me know when you can no longer hear it, okay? Alright, so here we go. Close those eyes for me. Very good. 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 Very good. Go ahead and open your eyes. Okay. Now outside of the tuning fork, I want to test a different kind of sound. Alright? So, again, just want you to close your eyes. Let me know when you can hear the sound, okay? Alright. Close them for me. Here we go. Good. Good. All right. Very good. Yes. All right. Good. Mm-hmm. And one more. Very good. It's a little bit of an unusual sound, but we want to make sure you can hear everything. And for the last portion of this hearing test, we're going to do a traditional hearing test. So I'm going to place these headphones on you, and I'm going to be playing a lot of tones inside of your ear, and I just want you to hold up the finger and let me know when you hear them, okay? And I want you to hold it up on either your left or your right to indicate which ear you're hearing the tone in. Alright, so I'm going to just put these on you. Good. Very good. Are you ready? And there we go. Just place those down there for now. Well, my friend, I think your hearing is perfectly intact. And that's going to bring us to the last portion of our exam, which is the sensation test. So most of our patients find this to be the most relaxing part of the exam. So what I'm going to be doing during this time is touching your face with different objects. And I want you to tell me if they're sharp, cold, soft, and I'll ask you to tell me which one it is, okay? So for the first part, we're going to start very easy. And we're just going to use a Q-tip. And then my handy dandy all-purpose tool. This is just a very dull tip. And then we have the nice soft cotton swab. So for the sake of this exam, we'll call this sharp. We'll call this soft. And as you can see, I'm just going to touch you gently. Doesn't hurt. Touch you again. You see how it feels? So close them for me. And you tell me if it's sharp or soft. And touch. Sharp, good. Touch. Soft. Touch. Sharp. Touch. Soft, very good. Touch. Soft again. Touch. Soft. Sharp, very good. Touch. Sharp. Touch. Sharp. Good. Alright, go ahead, open your eyes. Blink a few times if you need to. Now look straight at me, and what I'm going to do is going to reach up here, and I'm just going to press on your temples. Does that feel the same on each side? Good. One more time. Does that feel the same? Good. 2 spots on your forehead here. Going to. Does that feel the same? Good. Reach around the back of your head. I'm just going to tap gently. Good. Feels the same on both sides. Good. One more time. Good. Okay. Now, I'm going to test your sense of pain, and no, this isn't going to be extremely painful. This is just a small pinwheel device. It is sharp. It will only be gently rolling across your skin, just enough to trigger a slight, and I mean slight, pain response. And at the same time, I'm going to be using this very, very fluffy brush. And we're going to do another sensation test. So you're going to tell me if you feel any kind of pain or if you feel the brush. Alright? Okay, so close them. Here we go. Yep, that's the spike you want. And that's the brush. Good. Okay. And just one more down here. The neck area. Good. Okay, open your eyes. See? It wasn't that bad. Put that down. We're going to do something a little more sensitive. So I'm going to use an even tinier brush here. So you can see it's very, very soft if you feel that. And we're going to use this brush again too. Now they feel very similar, but I need to be able to see if you can judge the size of the object touching you. As you can see, this one's big, this one's tiny. So close them for me. Here we go. Against the little one. The bigger one. Yes. Good. Very good. Good. Wonderful. Yeah. Good. You can go ahead and open your eyes. Alright. Well, my friend, how you feeling? Good? Good. I have to say, didn't find a thing wrong with you. So, that will conclude our exam for today. And if you need any other kind of exam, ear exam perhaps, a more in-depth eye exam, please give us a call. I'll be more than happy to accommodate you. Why don't you go home, make sure you hydrate well for the rest of the day, and get a good night's sleep. And if you need us, we're here for you. Alright? I'll see you soon. Bye-bye.